Mecklenburg County's health director sounded the alarm 3 months ago over the rate of HIV transmission in Charlotte. It's nearly double the state average.
There is a relatively cheap way to try to reduce that transmission rate. It involves giving addicts clean needles. Other counties do this. I investigated why Mecklenburg County is not, at least not yet.
So if someone comes in and...
This cabinet at the Cabarrus Health Alliance holds cheap supplies that can prevent a very expensive and deadly problem, the spread of HIV through the sharing of needles by drug users.
We have long needles and short needles. We have cotton swabs. We have ties.
Last June, Marcella Beam started a needle exchange program so drug users can turn in old needles and get brand new ones. The concept is controversial to some and was once banned from public funding. But the STOP Act of 2017 now allows local taxpayer dollars to fund these exchanges. In 6 months, the Health Alliance gave out 4,740 needles, but people turned in more than 5,600 needles that can no longer pass along HIV or end up discarded on the streets. Needles cost about 50 cents each. The cost to taxpayers to treat a person with HIV for a lifetime, up to $619,000. That's why Beam says preventing even one case is worth it.
Just one puts us in a situation of ensuring that taxpayer dollars aren't going to that treatment, but also that people in our community are safe.
Mecklenburg County has no similar program, but a much greater need. 6,600 people are living with HIV. 4% say they were exposed by injecting drugs with needles. But a whopping 36% of patients did not identify how they got the virus. So drug users could account for a much larger percentage.
It was obviously
That's why resident and nurse Nick Forney has been exploring the idea of a needle exchange for Mecklenburg. 2 of his childhood friends died from heroin overdoses.
they were just normal people.
He knows addicts will shoot up whether they have clean needles or not.
My biggest obstacle is getting money for it. I can do all the other pieces. I can't pay for it, though.
In cities like Charlotte.
Back in November, Mecklenburg County Health Director Gibby Harris told commissioners the HIV transfer rate here is alarming and something needs to be done about it. So I asked her why the county doesn't have a needle exchange program.
We're looking at the different strategies in those areas, the things that we need to implement here. Needle exchange is one of the things that's come up in that conversation.
Harris told me she's now asking the health department's newly created executive board to create a needle exchange. It would supplement the PrEP program using the drug Truvada to protect people at a high risk for the virus with a daily pill. And Harris says those who are already infected need attention too.
The opportunity for those people to be well as they're living with HIV and be productive in our community as opposed to being a drain on the community is critical.
And Forney wants to help. Whatever the cost of a program, he considers a small price to pay.
It could be, though, a matter of a 50-cent, a 10-cent syringe makes the difference.
Harris told me county commissioners got an update on the needle exchange idea at their budget retreat last Friday. She's hopeful this will get done in Mecklenburg County, but right now just can't say when. WSOCTV.com has a long list of local needle exchange programs in the area. Look on the 9 Investigates page and inside my report.